What fentanyl actually does to your body before you die. Marcus is 26 years old, and it's a Saturday night in Atlanta. Someone at the party passes him something small and white that looks like a painkiller. He hurt his back last year, and he's taken painkillers before, so he takes it without asking what it is. He has approximately 4 minutes before his body begins to shut down. Good, you're here. My name is Dr. Morbid, and today we're examining Case File 001 Fentanyl, the drug that is currently killing more Americans than any other substance in history, including heroin, cocaine, and methamphetamine combined. Most people who take fentanyl don't know they're taking fentanyl, and that is not an excuse. That is a cause of death. Marcus didn't know, and what happened inside his body over the next several minutes is something every person watching this video should understand. Not because it will happen to you, but because it might happen to someone standing next to you, and when it does, you will have 4 minutes to decide whether they live or die. So let's begin. The moment Marcus swallowed that pill, a chemical called fentanyl began dissolving in his stomach, and fentanyl is a synthetic opioid created in 1960 by a Belgian chemist named Paul Janssen as a surgical anesthetic. It was never designed for recreational use. It was designed to knock out patients before someone cut them open. It is approximately 100 times more potent than morphine and 50 times more potent than heroin, and a lethal dose of fentanyl is 2 milligrams, which is smaller than a few grains of salt. You could fit a lethal dose on the tip of a pencil and not be able to see it clearly. Now your brain contains something called opioid receptors, specifically 3 types: mu, delta, and kappa. These receptors exist because your body produces its own natural opioids, endorphins, and enkephalins to manage pain, reward, and stress. Evolution built this system to help you survive, to make you feel relief after injury, to reward you for eating and reproducing. Fentanyl does not care about any of that because fentanyl floods every opioid receptor in the brain simultaneously, primarily the mu receptors. It binds to them with a grip that your natural endorphins cannot come close to matching. The result is a chemical signal so powerful it overrides nearly every system in your body, including the one that tells you to breathe. Stage 1, the rush, 0 to 60 seconds. Marcus feels it within 60 seconds, and he's felt painkillers before, the dull warmth, the edges of things softening. But this is not that. This is a wave that starts in his chest and moves outward through his entire body in under 3 seconds, and every nerve ending simultaneously receives a signal that could be described as the most profound relief a human being is capable of feeling, because fentanyl has triggered a dopamine release in his nucleus accumbens, the brain's reward center, at a volume that no natural experience can produce. Food, sex, love, achievement, none of them come close to what Marcus's brain is registering right now. His body believes it has just been saved from something catastrophic, but it has not been saved. It is being poisoned. Stage 2, the warmth, 60 seconds to 2 minutes. Marcus smiles and leans against the wall. Someone asks if he's okay, and he says yes, and he is not okay, but he doesn't know that yet, and he won't know it for the remaining minutes of his life. Mu receptor activation is now triggering vasodilation. His blood vessels are expanding. Blood is flooding to the surface of his skin, and he feels warm, flushed, comfortable in a way that has no rational explanation, and his pupils are beginning to constrict, which is called meiosis, and it's one of the most reliable external signs of opioid overdose. So if you see someone with pinpoint pupils who cannot be fully roused, that is a clinical sign and you need to remember it. His heart rate is slowing, his blood pressure is dropping, and his body is beginning to operate at a reduced capacity across almost every system. And Marcus doesn't notice any of this because by every subjective measure, he is feeling better than he has felt in years. Stage 3, the nod, 2 to 4 minutes. Marcus can no longer hold a conversation, and this stage is called the nod. His consciousness is not switching off, it's flickering, in and out, present and absent. He is aware distantly that something is happening, but he cannot form the thought clearly enough to act on it. Fentanyl is now suppressing activity in his cerebral cortex, the part of the brain responsible for conscious thought, decision-making, and voluntary movement, and he cannot call for help, not because he doesn't want to, but because the mechanism that would allow him to form that intention and execute it is no longer functioning at the required level. People around him may think he's drunk or tired or just very relaxed. And this misidentification kills people every day because his respiratory rate is now below normal. He is breathing, but less and slower, and each breath is slightly shallower than the last. And the clock is running. Now, before we go further into what happens to Marcus, I want to open a second file, and you may already know this case. November 15th, 2017, a tour bus parked outside a venue in Tucson, Arizona. A 21-year-old musician named Gustav R., known to the world as Lil Peep, was found unresponsive by his tour manager approximately 30 minutes before he was due to perform. He had taken what he believed were Xanax bars, a common anti-anxiety medication he had used before, but they were not Xanax. They were counterfeit pills laced with fentanyl, and they were visually identical to the real thing. His friends were on the bus, people were around him, he was not alone, and the toxicology report confirmed fentanyl and alprazolam in his system. He was 21 years old, he had a show in 30 minutes, and he thought he knew what he was taking. Here is what the people on that bus did not know, and what you now need to understand, because the next time you're in a room with someone who is nodding off and unresponsive, this information is the difference between a case file and a phone call. The signs were there: pinpoint pupils, slow, irregular breathing, unresponsive to noise and movement, a blue tint beginning at the lips, and nobody on that bus recognized what they were looking at. And by the time they did, the 4-minute window had closed. Gustav R. and Marcus are the same case file, different names, different cities, different circumstances, identical mechanism, identical outcome, and in both cases, identical preventability. So let's return to Marcus because we're not finished yet. Stage 4, respiratory depression, 4 to 6 minutes. This is the stage that kills, not the rush, not the warmth, not the nod. This because the brainstem contains a cluster of neurons called the pre-Botzinger complex, which is your body's breathing pacemaker, and it sends rhythmic signals to your diaphragm and intercostal muscles, the muscles that expand your chest and pull air into your lungs. And fentanyl suppresses the pre-Botzinger complex. The signals don't stop immediately, they slow, and the intervals between breaths become longer, 4 seconds, 7 seconds, 12 seconds, and Marcus is still breathing, but his body is now receiving less oxygen than it needs to sustain normal function. At this point, someone who knows what to look for could still save him. His lips may be beginning to turn blue. His breathing is slow and irregular, and his body is completely unresponsive to external stimulation, and he cannot be woken up. You cannot shake him awake. You cannot slap him awake because the receptor binding that fentanyl has achieved is too complete for any external stimulus to overcome. And only one thing can reverse it, and we will come to that. Stage 5, hypoxia, 6 to 8 minutes. Marcus's blood oxygen saturation is now critically low, and normal blood oxygen saturation is between 95 and 100%. Below 90%, organs begin to experience stress, and below 80%, brain cells begin to die. His brain, which consumes 20% of the body's total oxygen supply despite being only 2% of its weight, is now being starved, and brain cells do not regenerate. When they die from oxygen deprivation, they are gone and the damage is permanent. And this is why survivors of fentanyl overdose sometimes wake up with cognitive impairment, memory loss, or physical disability, even when they are technically resuscitated, because surviving a fentanyl overdose does not always mean surviving it intact. Marcus's organs are beginning to experience the same deprivation: his kidneys, his liver, his heart muscle itself, and his body is shutting down in a systematic sequence driven entirely by the absence of oxygen. And he feels none of it because the fentanyl is still active, his mu receptors are still fully bound, and by every neurological measure available to him, Marcus is comfortable. And this is the part that is almost impossible to explain to someone who has not studied it. The most catastrophic physiological event a human body can experience, and the person experiencing it feels no distress. Stage 6, cardiac arrest. The heart is a muscle, and muscles require oxygen, and as Marcus's blood oxygen levels continue to fall, his cardiac muscle begins to experience hypoxic stress, and the rhythm becomes irregular, a condition called arrhythmia. And then without ceremony, without warning, without any external sign that distinguishes this moment from the one before it, the heart stops. Marcus is 26 years old. He took one pill, he was at a party, and he did not know. Marcus's case is not unusual. It is not a cautionary tale from a different world. It is a Tuesday in America, and in 2023, over 74,000 people died from synthetic opioid overdoses in the United States, and the majority of them, like Marcus and Gustav, did not know they were taking fentanyl. Fentanyl is now present in cocaine, in counterfeit prescription pills, in MDMA, in substances people believe are entirely different drugs, and you cannot see it, you cannot taste it, you cannot smell it. Fentanyl test strips exist and they cost less than $1. They detect fentanyl in any substance in under 2 minutes, and in many places, they are available free of charge at harm reduction centers and pharmacies. And that is the first thing you need to know. The second thing you need to know is naloxone, brand name Narcan, which is an opioid antagonist that binds to the same Mu receptors that fentanyl binds to and physically displaces the fentanyl molecules, reversing an opioid overdose in 2 to 5 minutes, and one dose is often not enough for fentanyl specifically because fentanyl's receptor binding is so powerful and its concentration so high that a single dose may wear off before the fentanyl does, so always administer a second dose if the person does not respond within 2 to 3 minutes. Naloxone is available without a prescription in most U.S. states and in many countries worldwide, and many harm reduction programs provide it free of charge. And if you witness an overdose, you call emergency services immediately. Administer naloxone if you have it. Place the person in the recovery position on their side to prevent choking. Give a second dose after 3 minutes if there's no response, and stay with them until help arrives. Marcus had 4 minutes and Gustav had 4 minutes, and 4 minutes is enough time to save someone's life if you know what you are looking at. Before we close this file, here is what Dr. Morbid needs you to walk away with. Consider this your clinical briefing. 2 case files, Marcus and Gustav, different lives, same drug, same outcome, same missed window. And here are the 3 signs you must be able to recognize. Sign 1, pinpoint pupils. And if someone's pupils are constricted to the size of a pinhead and they cannot be fully roused, that is not intoxication. That is an opioid overdose in progress. Sign 2, breathing changes because slow, shallow, irregular breathing with long gaps between breaths is the body's breathing pacemaker being suppressed, and this is the stage that kills. So if you see this, the window is open and you need to act immediately. Sign 3, unresponsive to stimulation, and if you cannot wake someone by calling their name, shaking their shoulder, or applying pressure to their sternum, do not assume they are sleeping it off. Assume the worst and act accordingly. One intervention naloxone is cheap. It is accessible, it works in 2 to 5 minutes, and it does not affect someone who has not taken opioids, meaning there is no downside to using it when you are not sure. One number in the U.S. The SAMHSA helpline is 1-800-66-24357, free, confidential, available 24 hours a day. Marcus and Gustav did not have someone nearby who knew these 3 signs, but you do now. And if someone you know needs to see this, share it, because these 3 signs are only useful if the right person has them when it matters. And while you're here, subscribe because Dr. Morbid has 9 more files to open, and every single one of them could put you in the right place at the right time. Case file 001 closed. 2 files open today. 2 outcomes that did not have to happen, a chain of events that could have been interrupted at multiple points, with a test strip, with awareness, with naloxone, with someone nearby who knew what unresponsive and blue lips actually meant. The human body is remarkably resilient and can survive an extraordinary number of things, but fentanyl is not one of them. And unlike Marcus, unlike Gustav, you will know what you are looking at. And if you found this examination useful, subscribe, because Dr. Morbid has 9 more case files to open, and every single one of them could save a life.